Well, welcome to this talk. Now, we've done lots of talks on Skype, and you always feel a bit disconnected. So I'm delighted that Daniela's come for the first sort of in-person interview, albeit with somewhat impromptu technology. Now, the reason I wanted Daniela to come is because she's living in Denmark, but she's from Romania. So Daniela, thank you very much for coming. Now, we've just looked at some graphics, haven't we? And the cases in Romania didn't seem too high, but do you suspect they're being underreported, the COVID cases in Romania?
Absolutely, but first of all, thank you very much for having me here and for taking an interest in my country and for giving me the opportunity to talk about my country. So, thank you
for coming.
Yeah. About the cases, so I should say that I'm not a medical professional.
No.
I have been living outside of Romania for the last 13 years, but I'm in close contact with my family and I go back there about 3 times a year. So I'm in close, close to the country.
Sure.
It is what I would suspect, that the number of cases are underreported, and of course also the number of tests that are being made is not so high. And
so it's not surprising if they're testing less, then there's going to be less apparent cases.
It's not a surprise.
No, but the infections we expect, because of Omicron now, we expect the infections are really quite high.
That's the expectation.
That would be the
That's
expectation.
The logical
expectation. Absolutely. Yeah. And we also noticed the vaccination rate was only just above 40% for people that have had 2 vaccines.
Yes.
Now, that concerns me because it means a lot of people are going to be prone to severe illness, hospitalisation and potentially death. But why do you think the vaccination rates are as low as 40% for full vaccinations?
I would think of 2 reasons. So the more pragmatic and logical one is the lack of trust in authorities, which in Romania's case is very strong, given also our entire history.
Sure.
Post and
we could maybe just mention that. Just give us a quick resume. So Romania was communist until Soviet communist.
Yes.
1989.
1989. So 45 years of communism and a very tough communist regime.
Yeah, it was
extremely tough. Yeah. It's also a pity. I would think that there's not so much knowledge about how much the Romanians have suffered. Either abroad or within the young generations in Romania. But the entire elite was practically tortured in communist prisons. And so we ended up with a bit of a distorted scale of values in our society.
Yeah, I mean, for me growing up, it was just there was an iron curtain.
Yes.
I remember when I was travelling in Europe, going up to the border, and you come to the fences, and the guard posts with machine guns, and it went as far as you could see, and it was literally an iron curtain. It's, for young people today, it's really hard to imagine. And then when the communism first stopped, we were in a group that went to Romania, and quite a lot of people did. We went in trucks, and
with AIDS.
I think probably a lot of it was junk actually, but we certainly went with trucks full of things.
Yeah.
But I mean, to be fair, I did get some good quality drugs. I was able to buy, proper pharmaceuticals, in-date stock items of pharmaceuticals, which was good. But that's a bit of a digression. But it's interesting. So after that, Romania was basically independent since 1989.
Yeah, we would say so and think so. So at a declarative state, you could say that communism was over, but in effect, it was a new party which basically was made up of former
the same old guys changed the hats
exactly and that went on for 15-20 years.
Ceausescu changed to Iliescu, I seem to remember.
That was the change, and that was a very big set, even worse.
So it wasn't really a change, it was just a change of and I think we could think of other leading people in the eastern parts of Europe who used to occupy senior roles in Soviet organisations, but we don't need to talk about those in detail. So the point is, this lack of trust has been carried on. That there is a lack of trust in authority, and is this through all levels of Romanian society that this lack of trust?
And it's justified.
Yeah,
it's absolutely justified.
So is there ongoing problems with poor leadership and corruption in Romania now?
Absolutely. I mean, now I'm going to use tough words, but I wouldn't say poor leadership. I would say incompetence and corruption in the political system, unfortunately. Mm-hmm.
So is the corruption at different levels in Romania? Is the corruption limited to the upper tiers or is it kind of corruption all the way down?
I think it's system corruption. Systematic corruption. It goes all the way down. But the worst and the one that provokes damages to the society is the one in the political system, right? Because unfortunately everything that is state administered, as I see it, is basically lacking administration, it's lacking investments, it's lacking development, it's stagnating, and that includes the medical system, which is state administered, so the public medical system.
And you're actually an economist, we perhaps should have said, so you're in a good position to be able to to judge these things much better than I am. So the lack of vaccination is related to the general lack of. So if the authorities say this vaccine's safe, people are going to say no, it's not.
Yeah, people are going to say we don't believe what they would say. You're trying to impose something on us. This is it's coordinated from abroad. You're just following what you have been taught or asked to impose or to promote here in the country.
And people simply don't believe it and don't follow it.
They don't follow it, no. So.
Yeah, that is really quite a problem, isn't it? I mean, what about the hospital system in Romania? I mean, I know when I went there in the 90s it was pretty bad. Have things improved?
I wouldn't think so, not for the public system. So no investments, no new hospitals. And whatever modernization of existing hospitals, it's either made of private investments or donations or private projects, but not public, not so much. I mean, it must have been also a little bit of state investment, but nothing that would really make an impact.
Right, so people do get sick. It is a bit of a problem, really.
Absolutely. So we have a private medical system. We have private hospitals,
which are quite good.
They are, but they are also expensive, right?
Sure. And, so what? Only 5% of the population, 10% of the population can afford that.
Probably, yeah.
Yeah. So that leaves 90% of the population that have really limited.
Yeah, or the rest would have to really spend a lot of their income and savings and whatever there is available for on health problems.
Even go into debt is possible.
Yeah. So.
Yeah, that's a sad situation. I mean, what about the sort of belief in healthcare in Romania? Do people believe in westernised medicine, or do they like folk remedies and herbal medicine? What's the kind of culture?
I think in general, Romanians, we are close to nature. We live in communion with nature, with a lot of respect, and we're tied, the authentic Romanian. So that's the authentic Romanian spirit. We are tied to the land.
Interesting.
Yeah, we see the land as the communion with nature, the communion with our ancestors, with our families. That's where my father is, my grandfather, my grand-grandfather. So it's a respect. We're in harmony with nature. Yeah, that would be the authentic Romanian.
But that's a fairly widespread sort of philosophical approach to life in Romania.
That's the essence, I would say. Yeah, of our spirit. We used to be an agricultural country. We have land very good for agriculture and some sort of idyllical rural.
Yeah, it sounds nice. Yeah.
I see it like that. Yeah.
I mean, it's a beautiful country. I mean, I've walked through woods in Romania in the Carpathian Mountains and Transylvania. Just beautiful place, and very, as you say, very agricultural.
Yeah. And also with very varied geography. So we have plains and hills and mountains and the seaside and forests.
Yeah, you've got it all. Yeah. And there's natural resources there as well.
Yes. So we said gold in the mountains and oil in the sea and forests and the agricultural land. So we do have phytotherapy, and we believe in this in using plants and plant-based teas and all sorts of treatments, and also in just living naturally.
Sure.
So we're more inclined to the natural remedies and natural lifestyle. Also, we think that the positive mindset, I shouldn't generalize, that's my perception. So now I use the term we.
Yeah,
So
no,
that's my
you're
perception.
allowed to give your perception. That's
Yeah.
you're qualified to do that. But you've noticed the difference between that approach in Romania and the approach in Denmark, for example. You notice the difference.
Absolutely. So Danish society is very homogeneous, and they are very disciplined. If they are told one thing, they all follow it.
Yeah.
And they all do it in community, so they don't stand apart from the group.
Right.
So,
Yeah.
If they are told the vaccine is good, they would do it all. You should not.
Yeah.
You don't stand apart.
Yeah. So Romania is more individualistic.
A little bit, yes.
Yeah.
And also, they like to just have a bit critical thinking, but it's not that. I think also, yes, it seems to me that the Western societies trust more or rely more on the medicine, the conventional medicine.
Maybe a more sort of scientific underpinning to it.
While we do believe that nature and optimism and also faith has an impact. And I also believe that. Actually.
Yeah, sure. Maybe come on to that in a minute, but I think, I don't know if you've noticed it, but there seems to be that sort of what we might call biomedicine and science has really taken a hammering in this pandemic.
Yes.
You've got a lot of anti-scientific thinking in the United States and in the UK, maybe even in Denmark, maybe less so in Denmark, but people that would believe doctors, would believe scientists 2-3 years ago. My perception is that they're less willing to believe them now. Is that have you noticed that in?
I have not, to be honest, not in this pandemic, but I was
in Denmark.
sensing.
It's not such much of a problem then.
No, I think this is not an issue. But my perception again was that somehow we are moving in the direction of biomedicine and a bit, holistic healing rather than the conventional medicine. That's my perception. Apart from the pandemic, but again, I don't know if you, the professional, would validate that.
I just make videos these days. So is the Orthodox Church still quite influential in Romania?
It is very influential. But again, Romanians, they distinguish between the church and faith.
Interesting. Okay.
Still. So
faith is more personalised, whereas the church is more institutionalised.
Exactly, yeah. And yet, the church has a lot of power. Actually, I think it has the most power. But, and it's a bit inexplicable, right? Maybe it's for the people who are not very educated, on which the church has influence and power.
Okay.
But in my family and among the ones that I know, we make a distinction between faith and church. And church is corrupted as well.
Okay, right, okay.
So it is corrupted.
Yeah. So individual faith is not necessarily represented by the Orthodox.
No.
The Orthodox Church.
But the church is indeed influential, and actually the Romanian authorities used the help of the church to convince people to be more open towards vaccination.
I think there's some other countries trying to do that as well. They're trying to use the organised, traditional sort of avenues of religious practice to get politically what they want. And I think that's I think that's probably happening quite a bit. Now, we just looked at a graphic as well. The death rate in Romania, if we take this pandemic as an example, it is quite a bit higher than the United States per capita, per individual, higher than virtually anywhere actually, compared to the States, Canada, Europe, England, Denmark. It's a lot higher. Why do you think the death rate is higher? Do you think it's the problem accessing healthcare that's part of the problem, or do you suspect other things?
I think it's also a matter of how it is reported. Right? It's a death of a person with COVID, not necessarily of COVID.
Right.
So I think it would also be a matter of the general health state of the population. Romanians don't really have a very healthy lifestyle. We don't eat very healthy food, unfortunately. At least what we get in the supermarkets is not the best quality. We don't regularly exercise.
Supermarket food's actually quite expensive often by local standards.
It is expensive,
isn't it?
yes. It is expensive, and it's of poor quality. The things we eat, I'm sure, generate cancer, at least if we think of salami and all the nitrates and...
Preserved meats and things, yeah. Yeah, I found that in Romania. I found that, especially in the countryside, there was quite a bit of meat.
Yes, we also...
quite difficult to eat, quite fatty. Eggs, milk, things like that. So that's okay. But yeah, the variety of vegetables and wasn't good, and very little marine food.
So we used to be, in a way, self-sufficient. Have our own house, our own garden, some hens, and just consume our own produced. That was very healthy, I would think.
Sure.
But as we become, more and more modern, instead of having a house with a garden, then you have 2 houses and you buy food in the supermarket. I think that's also encouraged a little bit. So, for example, it's all sorts of measures that make us less self-sufficient and more dependent.
It's this move away from the land, isn't it? This move away from nature.
And I think it's a pity.
So do I. So the death rates in Romania that are recorded officially. So I get most of my information from Our World in Data, which takes official sources. Is there accurate ways of measuring death in Romania? Is like we have the Office for National Statistics in England. I'm sure they've got the same in Denmark. Where
we have National Statistics Institute. So for sure, there are ways of collecting the data and reporting it statistically, accurately.
So I assume that was accurate.
But again, I think the perception is people die with COVID, not of COVID.
That's what most people are perceiving.
Yeah, that's what I heard among people from my family.
Which, of course, is still very much a debate. So the impression from your family is that most people that are dying with COVID, not necessarily of it.
Yes.
So they don't think COVID's too dangerous a disease. In that respect.
Not really. They're not extremely scared. And I've had in my family, I think, 12 cases of COVID.
Yes.
I have a big family.
But how are they?
They're all fine. No one was severe.
Okay.
Yeah, I think we've had 2 hospitalized in the beginning.
Yeah.
But they also recovered.
See, it is a concern that the data from the UK would indicate of the people that have died with COVID on the death certificates, probably about 90% of those actually died of COVID rather than with COVID. And I would suspect it's the same in Romania. So I suspect that from what you've said, that people are underestimating the risk of hospitalisation and the risk of death from COVID. But I think that takes us back to the lack of trust in authorities.
Absolutely. So I cannot argue with you because, as I said, I'm not a medical professional. So it's just it could be.
Yeah, it's just if the same applies, and because it's the same disease.
It is absolutely the same disease. It's also probably of how much, what sort of tests are they doing when the person is hospitalized.
Yeah, indeed, yeah. And there's no question in your mind that the healthcare infrastructure, but people that have got maybe moderate disease that could have survived with reasonable medical treatment, you suspect that some of those people are being lost because of they can't afford the medical treatment that would be required, or
I know of, so not personally, but I have read of cases of people who didn't want to go to the hospital, again because of mistrust, even in the medical system, and they died at home simply because they were treated with paracetamol, and that was not effective. I don't think it's because of lack of access to the medical system, rather by the reluctance to use it.
Yeah.
I think it could turn to an insufficient availability of the healthcare system should the people actually choose or prefer to turn to it.
Yeah.
We've had cases of fires in the public hospitals.
I remember that recently. Terrible loss of life.
Yeah. And we've had also, I read of one case of a doctor who died of exhaustion. So the doctors, they are very dedicated, very human, right? But they're dealing in a system which lacks resources due to lack of investment, I would say, due to corruption. So the human factor is very good.
I've actually worked with some doctors and nurses in Romania, and I was very impressed by their...
That's also our perception. So we trust the person. We know they are professionally good. We know they're dedicated. We feel the human connection, and the human factor is also they're good at diagnosis, on a more human or personal way, rather than relying so much on machines. And
Oh, that's good. Yeah, absolutely. Medical intuition is not allowed in Europe anymore. We just follow protocols.
Yeah, I'm sure they follow as well, but
it's an exaggeration. But it's it's very very much more so than when I was a young staff nurse, when we used to do things more intuitively. That's for sure. Well, while we're talking about Romania, Daniela, there's a corruption problem, and is there still crime is quite a big problem?
So the political system, in my perception, is incompetent and corrupt, and that leads to very big problems in the society. Because, as I see it, everything that is state administered is basically not administered. It's that the money are not invested, the money are used or taken. Right, so then education system is lacking investments, medical system, infrastructure, security, right? So, of course, if there's a lack of investments and the lack of security forces, then crime can flourish. And unfortunately, it does.
And I mean, that there are, it's no secret, there's Romanian criminal gangs operating in different parts of Europe.
Yeah, they are. Yeah. And as I said, due to corruption, sometimes they are being caught abroad and sent back to Romania to be prosecuted, and unfortunately in Romania they just get away.
It's not happening.
Yeah, it's not.
It's not a disincentive. So that's interesting to think about the pandemic, and it told us a lot about Romania in general. I must say, I mean, when I first started going there in the early 90s, there was a great deal of hope and optimism. Now we've got rid of the communists, so we're getting on for... That's 30 years later. Yeah. It's disappointing that things haven't developed more. I mean, how do you see the next few years? Do you think things are... It doesn't sound like things are destined to improve very much, really, doesn't it?
I don't know if I have become pessimistic. I love the people. I told you how I see the Romanian spirit, how I see the country as a rich country with good and soulful people, and simple and welcoming and hardworking. I also see the corruption and the failed system currently in the country, and I see, unfortunately, the effects it has on the society. So I see a difference between the authentic people and the current population, i.e. the current society. And I'm pessimistic about the current society. I'm wondering myself, where is the hope? My perception is that Romanians from the country see the hope in the Romanians from abroad. So I should also be realistic and say that, so the Romanians from the country hope that the ones from abroad will return and then change things. The Romanians that I have talked to from abroad, I think it was me and one other that wanted to return. I also changed my mind since. But that's the only way I see at this moment, that the Romanians who are abroad, at least some of them, come back and through personal example or just functioning differently, change mentality simply by their individual example. I'm not sure if it's feasible, but I think that's where the hope is.
I guess countries do go through cycles, the same as individuals go through cycles. So, So I wish I had some more immediate hope to offer, but it would be good if I suppose it would be good if people like you that have worked abroad, if you go back, you've got a lot of expertise. But then again, people have got to go with you. It comes back to this trust issue, doesn't it?
Yeah, it does, and it would probably not be an easy job, but actually I think it's a beauty. So
Yeah.
it is.
Oh yeah,
It's the country that formed you, right?
Yeah,
so,
absolutely.
Country, so in the end.
And it's interesting the way the pandemic's highlighted weaknesses in different societies and weaknesses in science itself, but the way it interacts with societies. And if people are more able to look at that objectively, this could be something actually good that's come from the pandemic. Yeah. That was fascinating talk, Daniela. Thank you very much.
Yeah, thank you as well. It was a real pleasure.
We'll see what your friends say about the video when they watch it.
I hope only good things.
Yeah, I think it was good. Yeah. Great. No, thank you. And pandemic-wise, I'm optimistic that Omicron will generate a lot of herd immunity.
I think the same
Romania.
way.
I'm optimistic. Mm-hmm. I'm slightly pessimistic that even though Omicron is less pathogenic than previous ones, it's still pathogenic. Mm-hmm. So there'll still be a proportion of people that get sick. So, maybe if this video can encourage people to go to hospital and take medical advice when they need it.
Absolutely, yeah. We definitely support.
That would be a good point, because people are going to be getting sick over the next few weeks, no question about it.
And we do have competent and dedicated doctors.
And with the lower levels of vaccination. Mm-hmm. I was just talking to an Indian doctor this morning, and he says that basically the patients he's getting in are unvaccinated. That's the problem. So what I'd like to invite you to do, just to finish, if you can look at that camera there, and just give some advice to your country people in Romania, and then we can use that as a clip. So I won't understand this bit, but if you want to,
I should do it in Romanian.
Oh, absolutely.
Okay.
This is a message for Romanians watching. Yeah.
Okay. So. În cazul în care vă îmbolnăviți, cu siguranță apelați la medici. Avem medici foarte buni, profesioniști, dedicați, care vă pot ajuta și trebuie să aveți grijă de dumneavoastră și cu siguranță nu pierdem speranța, luptăm și mergem mai departe împreună. Și vă iubesc.
Excellent, and we will play that as a short clip as well. So that's,
oh really?
Oh yeah. That's just a nice condensation of everything. Thank you. That was so interesting. Yeah.
Thank you. It was a pleasure.
Yeah. Hope you recorded that.
You can't go through it again.